Hello everybody, Keith Enfield, health and wellness expert. I want to talk to you about cancer. Cancer seems to be on the rise and we probably all know why. But regardless, let's get this treated. If you or a loved one has cancer, you want to listen, forward it to those people. It's a mitochondrial disease, a metabolic disease. Your energy powerhouses are under stress and we need to get that fixed. The number one thing that you can do to fix your problem with metabolic disease related to cancer is lower your glucose. Two fuels, glucose and glutamine, are feeding cancer and you need to drop those down. And how do we do that? Well, number one, you go keto, strong keto, hard keto. Number two, you do prolonged fasting. That means 3, 4, 5, 12, 14 days with medical assistance, and really just starve cancer that way. Your body will produce ketones, which are good energy sources for our body. It's called keto nutrition. It's a fantastic way to manage your system, and you don't need the sugars to live. Meanwhile, you're starving cancer. Secondary is exercise. The more muscle you have, the more glucose you suck up. Therefore, you don't leave any around for cancer. Thirdly, you want to do supplements. Probiotics, vitamin C, and if you can, do high dose IV vitamin C, anywhere from 50 to 100 grams a week. Number three is turmeric is very, very good. ECGC, which is green tea extract, is also very good, and resveratrol. Those are supplements that help lower your blood sugar. Oh, I almost forgot berberine. Lowers blood sugar as well and lowers glutamine. Also, other adjunct therapies such as hyperbaric oxygen therapy, red light therapy, and hot sauna therapy are all designed to help with oxidative stress and oxygenating your system, which is amazing for getting your mitochondrial health up and getting rid of cancer. Now, there's also ivermectin and mebendazole. These are interesting mechanisms of action. In fact, they have multiple mechanisms of action when treating cancer with very little load of side effects. Now, those are obviously prescription strength medications that you need someone to help you with. Now, when you go to speak to your oncologist, they're not going to talk to you about diet. They're not going to talk to you about mitochondria. They're not going to talk to you about ivermectin. They're going to push their chemotherapy and radiation. High dose chemotherapy and radiation, I think, really harms the immune system, and we need a healthy immune system. So when you're talking to your doctors and you choose to do metabolic therapy, which is lowering your glucose and raising your ketones, you're automatically creating a better environment for your body. And guess what? You're more likely to be able to tolerate lower doses of chemotherapy. In fact, that lower dose chemotherapy with metabolic therapy can enhance your survivability. A recent research came out with ivermectin and mebendazole that showed an 84% benefit by taking those two when it comes to cancer. And there's also other kind of things that you want to be paying attention to is what's your toxicity